Many people who have an international health insurance plan also have an option for evacuation and possibly repatriation, but people get very confused as to what these are. The evacuation is perhaps more easy to understand. So let's say you're living in a country, Singapore, and you travel to Indonesia on a trip. On that trip, you're involved in a car accident. You could be treated locally, but it's judged by the insurance company and the doctor treating you locally that there is better medical facilities that give you a better chance in Singapore. In that situation, you would be evacuated to Singapore for medical treatment. The normal definition of an insurer in this section of the policy is to evacuate you to a centre of medical excellence, but it's normally on the judgment of the evacuation company in combination with the local doctor. Generally speaking, the insurance company is not specifically involved in that discussion, but they can influence it. What I normally say to clients is not to be too worried. Most insurance companies do not want to be sued, and therefore the cost of evacuating you, perhaps compared to the total cost of treatment, is not going to be a big factor. What insurance companies are looking to do is make sure you're well treated. Repatriation is a bit more confusing. So let's say, take that same scenario. You live and work in Singapore, you're travelling in Indonesia, but you're from, let's say, America. In that situation, if you had the repatriation option, you would have the right to be repatriated back to the States rather than evacuated back to Singapore. Most clients find this a very attractive solution, and it can be, but it also comes with risks. The point being, from a medical point of view, evacuation to Singapore would always be preferable to repatriation back to the USA. The reason being that repatriation back to the USA could take 24, 48 hours, and if you're in a critical medical condition, actually you'd be much better off to be evacuated back to Singapore. Notwithstanding, some clients still want this option, and it can be attractive if the situation is not that critical and you want to be back in your home country where you feel more comfortable with the medical facilities and the surgeons. Perhaps you have a local hospital or doctor you're familiar with. If you're looking for help and advice on evacuation and repatriation issues, why not talk to us? Pacific Prime is the world's largest distributor of private medical insurance which has evacuation and repatriation options. So if you're looking to buy this type of cover, why not come and talk to us?